Good.
Hello, everyone. Welcome to our FBLA and March of Dimes webinar tonight. I am Greta Shortreed, serving you as your Wisconsin FBLA president, and I am so excited to kick things off tonight. Just a few reminders, if there's ever a point in which you need to speak on the call, don't forget to unmute yourself, and we do have someone monitoring the chat, so if you have any questions throughout the webinar, please feel free to ask any of them. Tonight's been made possible by a collaboration with the March of Dimes and our Wisconsin FBLA Vice President, who I now have the pleasure to introduce. So please welcome Miss Alabia Prasad.
Hello, everyone. Yes, and to exactly echo what Greta shared, we are so excited to be able to bring this webinar to everyone in each of our chapters. Please remember that we are in a webinar format, so we will be able to do some breakout rooms later in the meeting. But also, please continue to mute yourself while presenters are speaking, but feel free to use the chat. It will be monitored. Lastly, please know that we will be recording tonight's presentation so we can share this with everyone that was unable to make it to this event. This evening, we have two guests with us, Ashley and Emily from the March of Dimes. They will be going through sharing an introduction and history of the March of Dimes, and I will also be able to share my personal story and how I am connected with the March of Dimes. And we'll also take some time to discuss the mission work and finish with the March for Babies event. After all the information is over, we will be going into breakout rooms for a short challenge, and then we will connect back together for the closing and the challenges that Greta and I have set for every chapter in Wisconsin. Thank you again for joining us this evening. And with that, I would like to introduce the March of Dimes Executive Director, Ashley Musick.
Thank you so much. It's wonderful to be here this evening. Thank you for having us. I'm Ashley. I have actually been with the March of Dimes since 2016, and I have worked with many FBLA students, so it's a pleasure being here. Hopefully, if the DeForest team is on, I can say hello because I live in DeForest, so hi. Tonight, I want to get started, and I wanted to just share with you a little bit more about the history of the March of Dimes to get you started to kind of remember where did we come from. Did you know that the March of Dimes has actually been here for more than 80 years? We've led the fight for the health of every mom, every baby, starting with the fight against polio. So the funding from the polio vaccine came from marching around and collecting dimes. Today, our programs focus on addressing health equity and an ongoing fight for the healthy moms and strong babies. Immunization is also a critical part of prevention and healthcare that we've been working on, and so is advocacy and everything that we're doing to lobby at the Capitol. So sit tight. We got a lot of stuff and information here for you, and please chime in, add your questions to the chat. We want this to be everyone to be talking. If you have questions, let us know. We want you to be able to tell us what your why is at the end of this. Did you know that the US is the most dangerous country in the developed world to give birth? Let that sink in. So when we look at all of the countries that are developed, we are the most dangerous to give birth in. Your parents, your moms that are giving birth in the United States. We have the highest maternal death rate among the world's most developed nations. Among other nations, the death rate has been stable or falling, but here in the US, it's getting worse. Every 12 hours, a woman will die from pregnancy-related causes. The US maternal mortality rate is more than doubled. 2 babies die every hour in the US. And one of our most recent pieces that Emily will show you a little bit on later is our maternity care deserts. 5 million women live in maternity deserts, countries without hospitals to be able to go get your prenatal care before giving birth. March of Dimes focuses on a hidden issue. Though we don't often talk about premature birth, the lifelong impact that we have of being born too soon, infant mortality, death of children under the age of 1 year, This is actually a health crisis in the United States. It's more well known than diabetes, cancer. 1 in 10 babies is born too soon in the US. Will you hear about what happens in Wisconsin? It's time that we give this attention that deserves. FBLA has been a partner with the March of Dimes for over 40 years. And because of that partnership, you guys are helping us strive to make sure that we are giving all moms and babies a healthy shot. Taken alone, maternal death, prematurity birth rates in the US are very alarming. And when you add in race, that's another story to add, another layer. There's a very large health equity gap in the United States, and moms and babies are at risk. Here in Wisconsin, we have a vision. It's the same vision as our national office, just like your FBLA, right? You guys are leaders. They're leaders that are learning to be the best you can be. At the March of Dimes, we imagine a world where every mom, every baby, regardless of wealth, race, or geography, will have a healthy outcome. No income level, no race, no county, it doesn't matter where you live. Every mom and baby should be able to have quality care. Our vision is clear. The March of Dimes leads the fight for the health of all moms and babies. We do this through many different things. Our hat is, we have so many hats we wear every single day. Emily probably wears the most of them here in our state for the most part. But we do this through advocacy, awareness, research, programming, fundraising. And whether you know it or not, everyone is a March of Dimes baby. Why? Because our mission touches every single one of you. We all have a story on how we are connected to the March of Dimes and the work that is being done every day to ensure healthy moms and babies are the outcome. That's what we're all striving for. We all want that. So before we talk about our mission and dig a little bit more into some of these things that I just started giving and scratching the surface of, I want to turn it back to Lavia for her to share her why and why she is actually connected to the March of Dimes.
Thank you, Ashley, for all the amazing information. The March of Dimes has a rich history of leadership in the community and research. It helps us understand the alignment of FBLA and the March of Dimes so much more. We are so proud to partner with an organization that leads the fight for moms and babies. As Ashley shared, the March of Dimes mission touches us all, and we all have a story on how we are connected to the March of Dimes and the work that is being done every day to ensure the health of moms and babies. Last year, I was inspired by my predecessor, Justin Mildebrandt, and how he shared his connection to the March of Dimes and why it is important to our organization to raise awareness in critical funds. So this year, I'm going to continue this new tradition and share with you, my colleagues, my why and my story. As most of you do not know, I was born in India, and India has a problem with providing lack of medical resources for middle and lower class women and children. And also due to the lack of the sanitary and hygienic products and resources for prenatal care, it can be really difficult or arduous for mothers to continue with the pregnancy or have child loss at the early stages. It is important that all women and children, babies, receive the necessary care and resources to have functioning lives. Additionally, it means a lot to me because I have an aunt who suffers from infertility and has had over 2 miscarriages. And being able to support her through the funding of the March of Dimes is something that I would love to accomplish. It is also important for FBLA members to be able to use their skills as leaders to advocate for change for mothers and babies by fundraising, being advocates, and continuing to push for change in their local communities and FBLA chapters. I will continue to be supporting the March Dimes in order to raise funds for our communities that lack access to specific resources and medical needs throughout Wisconsin. And I will pass it off to Emily.
Hello, everybody. My name is Emily Cattell, and I'm the Maternal and Infant Health Initiatives Manager for March of Dimes, Wisconsin. As Ashley said, I have multiple different jobs that I do throughout the state. One of those is making sure that I spread awareness through statistics and data that is coming from the CDC and the World Health Organization. And then also one of the other things that I do is I work in grassroots advocacy in promoting policies to impact all families in the state of Wisconsin, and I'll talk about that further. I just want to give a shout out to Portage High School, where I graduated. I know we have current students from there on this call tonight, and then also if there's anyone from Wauwatosa East, because that's where I am at right now, living in Wauwatosa, Wisconsin. So our case for support. What is a case for support? It is the why behind all of our work. We have our mission and our vision, which is clear, and then we break it down and how we can make our impact. Here in Wisconsin, we have programs, advocacy, and fundraising as a way to activate as an FBLA member. Before we talk about that, I'd like to share with you the data, numbers, and facts on why the work that we do. One of the first things I'm going to put in the chat here is a website that can get you directly to our report card. So like I said before, the March of Dimes works really closely with the CDC and the World Health Organization to get the data to tell us how each of our states are doing. This is issued annually for every state, and it breaks down our maternal and infant health by county. We will have the new report card coming out in 2 weeks in the middle of November during World Prematurity Month. But right now in the chat is the link to the 2021 report card. Breaks down where we are at as a state and gives us a nice grade. So currently in the state of Wisconsin, we get a C. We've kind of matched the national average with our prematurity rate being 1 in every 10 babies born prematurely, our infant mortality rate being kind of the same as the nation. But as we move further down into the report card and we break down to different counties and things like that, we see some disparities. We definitely see different racial inequities across the state. We also see pockets in the state where we have women and families who are impacted more. So currently in the city of Milwaukee, they get a grade F for how poorly they're doing in maternal and infant health, with a 1 in 8 rate of babies being born prematurely. Also, I don't know who else is on the call here, but there are definitely some counties in Wisconsin up north that receive poor grades due to their outcomes. And one of those things that Ashley mentioned is why those counties further north have issues is the maternity care deserts. So a maternity care desert is a place in the United States that has no access to OBGYN care. So there may be a hospital, there may be emergency rooms, there may be clinics, but there's no place for a woman to get the care she needs when she's pregnant. So I also put in the chat the most recent report that March of Dimes put out for maternity care deserts, if anyone is interested in that further. We can go to the next slide. Again, you can access any of these reports on marchofdimes.com. You can get the the report card from the website that I put out there. And like I said, on November 15th, the website will be updated to our new 2022 website. And then also we have, if anyone is interested in learning more about their county or their city, we have another website called Perry Stats. That's the one on the right there. and you can break down and dig through whatever data you're interested in looking, and whatever data that might match your personal story when you're talking to people about March of Dimes and how it connects to you to help you fundraise or help you with your prematurity awareness campaigns in your schools. So Prematurity Awareness Month is coming up in November, and so we would just like you guys to come up with a way in your schools to fundraise or spread awareness. And so the way we do that is we have a toolkit for you. So you as a chapter or a member, later we'll have a breakout to help give you some ideas on how to get involved, but we're asking you to sign up for the toolkit. It will give you scripting, it will give you other ideas, and that link is here for you also to use. And then another way for everyone to get involved is through our advocacy. So as young up and coming 18-year-olds, you are learning more and more about the voting process in the United States. And one of the ways that young adults can get involved is through advocacy work. What is advocacy? Advocacy is vital, part of our March of Dimes mission. It is a tool we use to advance our efforts through public policies, programs, and funding. March of Dimes works to influence legislation, policy, and regulations at the federal and state level. We form local town halls in Washington, D.C., at our own capital, and we're advocating from coast to coast. March of Dimes is advocating for a lot of different things, and we've had massive successes because of engagement from leaders like you. From federal legislation to promote extending medical coverage postpartum, to passing protections for pregnant workers, to establishing maternal mental health advisory committees. March of Dimes advocacy efforts are making an impact in your community. And what are we prioritizing? What are we advocating for? It's just very simple things that we think everyone in who's pregnant or who's starting a family should deserve. And that's just increasing access to quality health care. So again, getting doctors to women who need doctors, supporting the health of women and babies. So making sure that they're being screened for all those preventable things that can happen during your pregnancy, improving research and surveillance, and then continuing to protect moms and babies during COVID-19. So we know that COVID-19 impacts moms and babies a little bit more than it would us healthy adults. So we just want to continue to help parents and families as they are still dealing with our national pandemic. So how can you get involved? So this advocacy work sounds really complicated and daunting, but there are ways each of you leaders can help and encourage you and your partners and your families and your advisors to join. And that's by joining us in the fight for healthy moms and strong babies by signing up for our advocacy network and acting on all these policy priorities. This is just adding your voice to the thousands of March of Dimes advocates calling for policies that promote the health of moms and babies. It's a really nice way to start your work in grassroots advocacy and starting to learn a little bit about how you can get involved civically as a young adult. And so through this next network, you'll receive alerts about opportunities to get involved on the state level. And again, just kind of to let you guys know how you as a young adult can be involved in the policy process, especially when it comes to something that you're working to fundraise for and spread awareness about. And then finally, for any of you interested, last year, March of Dimes Wisconsin had its first day of action at the Madison Capitol. It was a really successful day of action where we met with over 100 legislative offices to fight for moms and babies. Due to the success of this Day, we're going to do it again on March 9th. So that's coming up this spring. And we're going to do it in collaboration with all the March of Dimes markets. So we're going to have a national day of action called Blanket of Change. And this is just a national day to continue to promote policies locally within our state. So again, if anyone who is interested in the legislative process or your school FBLA group would be interested in doing something like this, let Ashley and I know, and we can definitely get you involved. Again, this would be a great way to learn a little bit more about the civic process and also how you guys can get involved as young adults in the policy change. So I talked a lot about a lot of different things, and my job is very complicated as I do many things within March of Dimes, but the biggest thing I want you to walk away from is how to use your voice to become an advocate if you have a personal story or something that you want to fight for. And the way to do that is the link I just put in the chat. And then the other thing is how to utilize the report card and the data to share your story. What things do you want to spread awareness about during Prematurity Awareness Week, and what you want to do with your personal story to help you fundraise for the March of Dimes.
Awesome. Thank you so much, Emily. Thank you for being here. So before we go on to the next slide, questions. What questions do you guys have for Emily? There's got to be at least one. We're not leaving this slide until somebody asks a question. Come off of mute. Do I need to find the Jeopardy music? Emily, what's your favorite part of your job?
I guess one of my favorite parts of my job is I get to engage with the Milwaukee community. So I recently just did a couple of community baby showers. So provided things like diapers and onesies. Again, it's really fulfilling to see a family in need come get the things that are essential for them to take care of their babies. So again, when you're fundraising for the March of Dimes, that's one of the things that I do with the funds that I receive to help promote healthy moms and strong babies in my community.
Awesome. Thank you. All right, we're on to the next, right? Is everybody falling asleep? We've got some polls coming up. Actually, with that, I'm going to launch a poll right now. So everybody's going to get a poll. I've got some questions about March for Babies for you all. Super easy questions. Do you know what March for Babies is? Have you participated in a March for Babies walk? And do you have a social media page? So I'm going to give you guys a minute here. We've got 7 people to participate. If everybody just wants to click through. All right, 5, we're missing 2. There we go. All right, I got everybody. Thank you all. I'm going to share this. We're going to end the poll here and we're going to share the results. Do you know what March for Babies is? We're about 50-50, right? So we've got about 50%, 57 say they do know what March for Babies is, but only 14% of us actually have been to a walk. And do you have a social media page too? Oh my gosh, you guys are like me. You never are on social media, 2 of you guys. But most of you do have a social media, and we'll talk about that here in a minute. So I'm going to skip on over and talk about a different way. So we talked about mission. We talked about a different way to get involved from the advocacy side of things, a way for you to understand the data, understand what's happening in our communities, and not only here in Wisconsin, but directly in your county, right? So Emily, thank you for sharing that. Great information, great websites for you guys to go and learn a little bit more and be a leader in maternal and infant health right in your community. So advocacy is one of the many ways that you can get engaged. We talked about that earlier. And we also have ways to fundraise raise through fundraising, March for Babies, do-it-yourselves, and community walks. We are a mother of a movement. March for Babies makes a visible difference in our communities every single year. We collaborate with community partners, sponsors, family teams, company teams, and we come together on a day to really celebrate, hope, remember, and be together to make sure that we can give hope and take action for all moms and babies. So March for Babies has been around for many, many years, all the way back to our polio days. And when we celebrate March for Babies, the energy that day is contagious. It is just one of the best feelings. You get to see families in the NICU re-engaged with some of the nurses that they've seen and they've worked with for years. You see companies coming together and engaging all of their employees around a simple fact that everyone wants a healthy mom and baby. So fundraising is something FBLA has done for many, many years, right? One of our top national supporters and partners. And why is FBLA one of those supporters? It's because FBLA also believes that together we can actually make a difference. March for Babies is more than just a walk. It's a time, like I said, for us to raise critical funds. It's a way to rally around moms and babies, giving every mom and baby hope to be able to start their pregnancy off and end their pregnancy with a healthy baby. We come together to create change, share experiences. This year, Emily was able to actually engage a ton of different community partners that we work with throughout the year with our programs, like the Stork's Nest, and It Takes a Village was there as well. So we were able to collaborate with all these community partners that we work with throughout the year. And we also honor motherhood, babies and families. This past year, we had our Wisconsin walk was in Wauwatosa. It was such an amazing, great hit that we will also be having our March for Babies walk again on June 3rd, 2023. So mark your calendars. Every and all are welcome to come. Here I put up just a couple of different pictures and things from the day. So you can see the energy, you can see the excitement and fun that everyone has. We have activities. We really truly get behind everything and all of the different communities coming together. So I'm going to flip through here. Now, over the past years, I've worked with many different FBLA teams. And the first question I usually get is, how do we fundraise? What do we do to fundraise? What does that mean to fundraise? Simple. You find something, and my computer's going to go black and we're going to go crazy here. I don't know what's happening. Oh, we're going to start over on my slides. Okay, hold on. We're going to pause my screen for a second. So we are, pause with me for a second, you guys. Technical difficulties are always fun. Okay, we're gonna wait for my computer to kind of restart here for a second. On my second screen, it is thinking. Okay, so FBLA, how do we fundraise? What do you do? We have had teams do own individual walks. We have had teams do miracle moments at different events that you're hosting, whether it's a basketball game and you've got two different schools and two different FBLAs coming together and you're trying to figure out who can raise more funds on which sideline. We also have miracle moments during some of your leadership conferences. So the Fall Leadership Conference, the State Challenge, the state conference that you guys have every year. We get all of the chapters, as many chapters involved, and we also try to do some challenges between the different teams. So we help you guys set a goal. We help you create a strategic plan, lead a campaign. One of the opportunities for March for Babies is to be a leader in your community, in your school, to be able to make a change for something that matters to everyone, right? Everyone has a story and a why, and everyone is connected to the March of Dimes in some sort of way. So we give you the tools. We have a toolkit as well. We have a social media kit that is the easiest way to fundraise, peer-to-peer. We will tell you that you can do bake-offs. You can ask teachers to wear jeans for a week and donate to the March of Dimes. You can wear, Go Purple Out is something else that the FBLA teams love to do during Prematurity Awareness Week. But also doing peer-to-peer fundraising, putting it on your social media, creating a bingo, $1 in every corner to see who can get a bingo first or a full blackout card. There's many different ways that you guys can fundraise. And so what we're going to do right now is, since we have about 7 people, we are actually going to break out into 2 different groups. And we are going, is my screen showing? Can someone tell me if my screen is working yet or not? It's not. Okay. So we're gonna do breakout rooms. We're gonna try to put this out into breakout rooms. Greta and Alabia, I'm sorry if this is my technical difficulties here. And your challenge for the breakout rooms is to discuss with everybody in your team. You're gonna get 5 to 8 minutes. Figure out what can you do during November, Prematurity Awareness Month. Brainstorm some ideas on how you can raise funds for your school during that week, right? So we learned there's awareness, there is data, there's all sorts of things to be able to support what you are doing. So I'm going to put you in your breakout rooms, come back in 5 to 8 minutes. I will bring you guys all back within 8, but come back with your ideas and let's just see if we can brainstorm some other different ideas. Any questions before I put you here out in breakout rooms? Okay. Well, here you go then. You should get a button to click and you can join one of those rooms. So everyone should be joining us back here. Room must be still discussing significantly. All right, I think we've got everyone back. Make sure here, it looks like it. Ooh, we gained a face. Natalie joined us by face now. All right, everybody, welcome back. I hope you had a great conversation. So now is your turn to unmute and share with us what you guys discussed. What did you guys brainstorm? How would you raise funds during Prematurity Awareness Month from your FBLA, from your March for Babies team for your school?
At my school, I would love to host a miracle moment at one of our sporting events, or then having a March for Babies walk in the springtime.
Awesome. You could do both.
Okay, at our school, we share our miracle moment by having people donate at our basketball game, and then the day of, we usually dress up in all purple.
Awesome. Do you get the whole school to dress up, Sophie?
Well, we usually tell them to dress up at our full group meetings, and sometimes we'll put it in the announcements, so like whoever can will. So
awesome. Who else? Natalie, Lucy, Greta?
I'd love to share mine, but Sophie is from my school, so we tend to celebrate the same day together, but it is a really great day. We do involve the whole school, as much people as participate, but we advertise to everyone to get everyone as much involved as possible, which is a really great opportunity.
Okay, awesome.
At my school, we've had success with some other organizations where we did a bake sale that goes directly towards a website that they can donate to, and then also making a poster with a QR code that goes directly to the website as well.
Awesome. We have found QR codes work really well, especially since COVID. Natalie, did you want to share anything?
So our school actually hosted one of the FBLA regional conferences last year, and so that was a really great way for us to like spread awareness about March of Dimes, especially to like our local chapter as they help fundraise, just like kind of facilitate the whole thing, and then along with like the attendees that were there. So that was a really great way, and then we're looking forward to like continuing with Miracle Moment in the future.
Awesome. Sounds like you guys are doing some amazing things. Super proud. One of the things that we will also tell you guys to do is share your story, get people involved outside of just FBLA too, right? Basketball game is a great example of that. I think that there's so many more things that we could do. If you guys are coming up with an idea and you need help, you need support, you're like, hey, I need a poster, I need something created, like reach out. We have a team here. I work with March for Babies for the most part. Emily does mission. So if you're having a problem getting through and to get data that's for your community directly, that might help share and get people engaged and interested in helping. If you want to do a diaper drive and don't know where to take the diapers, if you're doing something, we can be that connector point to help you figure out what's the best place for those to go to help moms and babies. So always feel free to reach out. We also have a person that does our signature chefs auction. She's amazing and would be always willing to help or create some fun things on social media. So when you guys do your fundraising, one of the pieces I want to make sure you guys know is there is a donation form, right? There's I am working, Alabia is helping me organize this, which I'm super very excited about. We're going to make sure everybody's school that there's a FBLA in the state of Wisconsin. Your FBLA school will be automatically created for the March for Babies. And then you will be able to go out and find your team significantly easy. So we always put it as FBLA-WI- your school name. And so I've gotten those. We are making sure they're all input correctly. And we are also encouraging all advisors to be signed up as the team captain. So as things roll over from year to year, all the hard work that you guys are doing today, this year, won't go, like you will be able to start creating that history from your school standpoint and being able to set new goals for the years after and for the people that are coming into the FBLA team as you transition out, right? Because everybody kind of moves up and on. So there is a donation form. Go out to your FBLA website. It's on your national FBLA website under sponsors and partners with March for Dimes, because I know there's a couple of them out there. If you have a question, don't know what your school name is, can't find your school name, reach out directly to me. I can help you find it super easily. I can make sure I send you the link. We can make sure that you get everything that you guys need. So next up, Greta, I'm going to pass the next slide over to you to start off.
Thank you so much. Well, Ashley did mention at the beginning that we were going to be putting out a challenge to you guys for everyone in attendance here today and for you all to take back to your local chapters. Part of FBLA's mission is to cultivate community-minded business leaders. So I really appreciate you all being on here tonight because it's significant that as leaders and as people with a voice and an ability to use that voice, we're putting it out to help support organizations like the March of Dimes. So my challenge for you is a relatively very easy one. I'm going to ask you all to post on your social media page, one post per month tagging at March of Dimes, Wisconsin. This is probably your local FBLA chapter's social media page. I know my chapter has Instagram and Facebook, so we'll definitely be looking to post on there once per month.
Great challenge. Alabia, do you want to share your challenge?
Yes. So I know most schools host Miracle Moments already and they raise a ton of funds already. So as an additional challenge, I'm challenging each school to set a goal to raise over $1,000 for your March of Dimes for March for Babies team.
So in addition to that, Lobby has no idea I'm about to say this. So she's gonna be a big smile on her face, hopefully soon. Is I don't know what the prizes will be at this point because we don't have, we're not in our next year yet, right? But we do this with a lot of our corporate teams where we try to figure out who's the top team in certain departments or certain industries that we look at. And so to help you guys with that $1,000 challenge, I will work with Alabia and we will figure out a good prize ranking for maybe like the top 3 or 5 schools, whether that includes swag or includes pizza parties or something like that. I will work with her and we will try to figure that out. So there's something in it for you guys as well, right? Because that's always a fun thing to do, be able to get your whole team together that's worked so hard to fundraise. So we will add that to that challenge as well. I am going to actually challenge the advisors. So all the advisors that are going to be listening to this and watching this recording, I'm going to actually challenge each of them and I'm going to work with them to register as the team captain. So you guys can have a legacy as you move forward through March for Babies fundraising with each of your teams, and your school teachers and your advisors will be able to get all of the updates because we need someone to get in there, register, and all of the information that March for Babies starts to share with someone in the school will be getting it. Now, that doesn't mean that none of you should register. You can have more than one team captain. You can also have multiple people as walkers that just raise funds on there, or if they just want to be a part of that team. I think when we look at the challenges, we'll probably say, okay, anybody that was associated with the March for Babies team as a walker or team captain, those are the people that would be able to do that fundraising challenge piece. So let us know if you have questions or challenges getting in there and registering. I will put the March for Babies registration in the chat, and then I'm going to pass it to Emily for her challenge.
Yeah, my challenge is just for advisors and students to register for the advocacy network, be a voice and part of the change that we're working towards here in the state of Wisconsin. If anyone is interested in doing this as part of their miracle moment, getting more students or more teachers or more parents or more community members signed up for our advocacy network, please let me know and I can send you a QR code that gets you to that link if that's easier to do at a football game or in the hallways of school. So please do register tonight. It's easy. Literally, you put your name and your address and an email, and that's all you do, and you get the updates. But if you'd like to further that challenge to spread it through your community, let me know.
Awesome. So 4 really good challenges. I'm really proud of this team for coming together and creating those. And then we wouldn't let you not have resources. So Emily shared a ton of great data resources and how to get the information about your communities, about a report card, about the mission. I also have some resources here that is really about the March for Babies and March of Dimes in general. Here you can pull off super quick, easy LinkedIn pictures, Facebook pictures, quotes, things that are happening. Prematurity Awareness Month pictures will be out there. So to make Greta's challenge super easy, go out there into the press kit and download whichever one you want to and automatically have that scheduled out. And then you can also find some of our stories. So if you're looking to inspire people on the video library, you're able to actually watch some of our ambassador stories, which is actually a really cool thing to kind of go through and find 1 or 2 that you really like. With that, I want to say thank you to everybody that joined us this evening. You are amazing leaders in our community. I look forward to you guys sharing this with all of your FBLA teams. And just know, like, together we can accomplish a lot. We can't do it alone. We need to drive impact for all moms and babies. And I'm excited to see everybody get pumped up this year and go out there and hit all 4 of those challenges. Greta, Olavia, do you guys have any closing comments?
I just want to say once again, thank you so much for everyone that participated and joined today's webinar. If you have any questions, like always, feel free to reach out to me or then Ashley. Thank you.